Hi, I'm Dr. Jaffer, and this is GotTeeth, a patient-centric monthly podcast featuring local health experts.
My name is Nitin Khandekar, and today on GotTeeth, we will be switching things up a little bit. I'll be putting our regular host, Dr. Jaffer, in what we've nicknamed the Dr. Google Hot Seat, where we will be asking him a series of the most popular dental questions asked on Google. We'll be doing this in a beat-the-clock fashion, and he will have approximately 10 minutes to answer as many of them as possible. The main reason people use a search engine when they have a question is to quickly get an accurate answer. However, when you Google something, the top of the results page will consist of advertisements related to your query. Below that will be a section entitled People Also Ask, where Google shows other questions that people ask that are similar to your initial inquiry that you may also find useful. We've selected a generous handful of those questions to put Dr. Jaffer to the test and see how he stacks up against Dr. Google. How are you feeling today, Dr. Jaffer?
Well, I'm excited. This is the first time I get asked the questions versus asking the questions.
You ready to knock this out of the park in speed round fashion?
I hope so. Here we go.
We're competing with modern broadband internet speeds here, so I hope you're ready. Hope your mental pencil is sharp.
Let's go.
All right, we've got a timer on here. I'm going to get started here once you're ready to go with the first question.
Let's do it.
All right, here we go. How do you fix bleeding gums?
So interesting. You would have to think about why you have bleeding gums. And generally, bleeding gums are due to inflammation in the mouth. And so in terms of taking care of that, obviously regular hygiene at home is really important. Brushing and flossing your teeth, coming in to see the hygienist so that they can actually do a good job of cleaning out the bacteria in your mouth and then keeping them healthy after that.
Excellent. So you've kind of answered the second question, which is what causes bleeding gums. And I guess to more detail, when should I be concerned about them?
So anytime your gums are bleeding, you should be concerned about them. Bleeding gums are not normal. People will often tell us, oh, only when I floss, my gums bleed. You know what? If only when you put your nail down your hand,
right,
your hand started bleeding, that would be a concern. So bleeding gums are always a concern. And your gums should never bleed if your gums are healthy. So anytime you're seeing a little bit of bleeding in the gums, it is something to be concerned about.
Right, and the old answer from the doctor of don't do that, and we don't want to have, but that's not our answer if somebody's bleeding when they're flossing.
No, we want to make sure that we
take
care of it.
Yeah, absolutely. Can mouthwash stop bleeding gums?
So mouthwash actually definitely can help. Mouthwash is antibacterial, and so it is bringing down the bacteria count. So in combination with brushing, flossing, and seeing your dentist, mouthwash helps. We generally recommend a non-alcohol based mouthwash, which any of the major brands out there will usually have a non-alcohol one. Just dries out your mouth better, so a little bit healthier for you that way.
Excellent. Now on a related subject, what causes gum disease?
So many factors that cause gum disease, mostly lack of taking care of them. There's obviously some level of through your parents and through genetics that does affect that, but the majority of what we see is people just not taking the time and effort to do that. We say brush your teeth for 2 minutes. They've actually timed it. The average person is less than a minute for brushing their teeth, even though they think so. And even being a dental provider, and I have a fancy toothbrush that times me, my average time, it'll tell me, is about 1 minute and 29 seconds. That's what it'll tell me. So even knowing that I should get to 2 minutes and trying to do the best job you can, it's actually a long time.
Yeah, fair enough. It's especially when you haven't planned accordingly for your morning.
Yes, you're running behind.
What about gum recession? If you have gum recession, can it heal?
So gums don't grow up, unfortunately, they only grow down. So can you heal gum recession? You can stop it from getting worse. Actually making it better, yes, there are procedures out there. There's a bunch of different gum grafting procedures that can help get the gums back to where they used to be. But you have to look at why they got there. And I think a lot of people forget that. It's like, hey, I have recession. Can we do a gum graft? Yes. But why did you get recession? And will we stop it from happening again? So again, getting to that core factor of, are you taking care of them? Are you grinding or clenching? A lot of people don't realize, but gum recession can be caused from grinding and clenching as well.
So dealing with the cause, not the symptom at
right.
the end of the day.
Yeah.
So moving on to something that might happen if you don't take care of your gums, what is the best option for replacing missing teeth?
So, there's a number of different options, and some of it has to do with cost, some of it has to do with effectiveness and efficiency. Obviously, we think the implant is generally the best way to replace a single missing tooth. Even to replace a number of teeth, implants can be better. And generally are the first choice that we would have. And a close second choice would be a bridge where you can have good teeth on either side, and you can, bridge the gap. Obviously, it causes damage to the teeth on either side. And then the third option ends up being a denture. Now, based on finances, based on what you're looking at, one of those may be better for you in a certain situation, but usually we move towards the implant.
Right, and which would be the most economical of those three?
The most economical would be the denture,
Right.
or a flipper, something that just temporarily fixes that. The downside is it moves around and it rubs up and down your teeth because they have clasps on them, and it pushes on the gum tissue, and so the denture can cause other problems in the mouth, but cost-wise is definitely the least expensive.
Okay. Now, for those who still have their teeth, but maybe they're getting a little harder to see them, what happens if your tooth enamel goes away?
So you cannot grow tooth enamel back. You can replace it generally with porcelain. So what we find is people that wear their teeth down may look at crowns. Sometimes fillings will work for that as well, but realistically you cannot replace enamel. You have to.
So no way, to the next question, no way to restore tooth enamel.
Not yet. I know where to grow a tooth yet, but modern science is definitely working on that.
Don't count against it, right?
No, for sure.
Now, let's drill down a little bit deeper. Wah, wah. Why should you never get a root canal?
Root canals are important for people that have problems in their teeth.
Okay.
So we actually absolutely believe that root canals are one of the options of keeping teeth in your mouth.
And how do you avoid it?
So obviously, why do you need a root canal? One is trauma and the other is decay. Those are generally the two main reasons. So you have a big cavity, reaches the nerve, now you're in some pain or discomfort. We need to do a root canal to really remove the bacteria that's gone to the nerve. So remove the nerve tissue out of the tooth because the tooth has died. Or, hockey player get hit in the face with a puck, and all of a sudden you need to, get something fixed.
Right.
And so both, are good reasons. And can you do a root canal on a tooth? Yes. Is it the first line of defense? We believe so. I mean, an implant is, we feel, the second line of defense. The root canal would be the first way we would try to deal with that tooth, because our preference is to save teeth and not remove them.
All right, and is that a one-day procedure?
Most situations, root canals can be done in a single appointment, depending on the level of infection, the level of inflammation inside that tooth. Sometimes we're doing them in 2 appointments, but I'd say, I think it shows about 80 to 90% of root canals can be done in 1 appointment.
And how long does it take to recover from a root canal?
Shouldn't really take any time at all. I mean, you could be back at work that same day. Is there going to be some pain and discomfort afterwards? Yes. In really any dental procedure, 24 to 48 hours of discomfort would be normal in a situation.
Fair enough. Now, if you just find the words root canal too frightening, you may be interested in the next couple of questions. How long does a dental implant take?
So once you have a tooth that's been taken out and it's been missing, if it's been missing for a period of time, the implant, procedure-wise, faster than doing a root canal. So you can put an implant in generally faster than doing a root canal, but then the implant has to heal before a crown gets put on there. And that's usually anywhere between 2 and 3 months, sometimes up to 6 months.
Mm-hmm.
But if you haven't had the tooth taken out and you're like, hey, do I do a root canal or do I do an implant? I mean, that, with taking the tooth out, possible grafting, implant placement, restoration, can take 6 to 9 months. It can be done in as short as probably 2 to 3, but on the, on the normal side, probably 6 to 9 months.
And how long should I expect my implant to last?
That's a great question. People ask that question a lot, and with anything, we always say, God gave you something and you managed to ruin it. Anything we're going to put in is probably not going to last as long as, what you were given originally. Having said that, implants are a long term, and they last, they've got about a 98% success rate over a 20 to 30 period, years of time. Now, not every implant's going to last that long. I do a fair number. I've had them fail earlier than that, but I've also had them last, that amount of time. So implants are definitely a good long-term solution for your mouth.
Okay, great. Now, if all of these procedures just scare you, you may be interested in knowing the answers to the next couple of questions. What kind of sedation do dentists use?
So you can use just, obviously freezing is the first line of defense, but if you want to be sedated, nitrous, so laughing gas, works really well. Oral sedation, some tablets, puts you, makes you a little sleepier. And then we go from there, from IV sedation all the way up to general anesthetic. General anesthetic is not done in a dentist's office. You have to go to a surgery facility, but we can do the first 3.
Right, excellent. And if you've had sedation, I guess what should you not do after being sedated?
You're going to need help. Right,
Right.
you're going to need somebody to drive you home. You can need somebody to watch over you for a period of time, but there's not a ton that would stop you from
Okay.
doing
Moving on to some more routine procedures. How do cavities develop in teeth?
Again, decay happens because generally sugar. So sugar causes acid in your mouth. That acid breaks down the teeth. So if you're not, taking care of your teeth, brushing your teeth, flossing your teeth, and cutting down the amount of sugar and the frequency. Frequency is actually really important with this, and people forget that. Dessert once a day, having something sweet, okay, not a problem. But having a Coke and drinking it for 2 to 3 hours, probably the worst thing you could do for your teeth.
Just keeps grinding away at that tooth, eh?
Yep.
Can you reverse a cavity naturally or otherwise?
Fluoride can help. There's some toothpaste that can help. So there are conversations around if you could get some special materials, and there are some in the dental office that we can use. We can slow down, if not stop, and sometimes reverse cavities, but they have to be small. Once they get to medium or large, there's no options.
All right. And if that cavity is just too bad and your dentist can't see you, how do you pull a tooth at home?
Don't do it.
Don't do it.
Don't do
No
it.
string on the doorknob.
Well,
right?
I mean, if it's a kid's tooth and it's a baby tooth that needs to come out, string on a doorknob definitely does work. But I wouldn't do it for an adult tooth.
All right. Couple of quick ones on cosmetic stuff. Is teeth whitening bad for your teeth?
No, it's okay once in a while. You don't want to do it every single day, but it does work in
Right.
whitening your teeth.
What exactly is Botox?
So Botox, it's a botulinum toxin. It actually paralyzes muscles. And what it does is it stops you from being able to contract your muscles, which is why people use it, because it takes away from wrinkles.
How long does it last for wrinkles?
About 3 to up to 6 months.
And if you use Botox for TMJ problems, is it covered by insurance?
So it depends. Again, depends on your insurance company. Depends. Sometimes your medical will allow you to buy the Botox, and then you just pay the dentist to inject it. So again, unfortunately, insurance is different. So it depends on your insurance.
Right. Well, I hope our audience will accept me begging for forgiveness because we went about 15 seconds over the time, but this has been very entertaining and hopefully very informative for all of you. Thanks very much to Dr. Jaffer for sitting in the visitors chair.
Hey, thanks for the opportunity. This is definitely fun.
All right.